Individuals with schizophrenia can oftentimes lack the ability to think critically about their symptoms or even recognize that they are sick. And so if you're not sick and you don't have symptoms, you don't necessarily need meds, is the dictation that many people have. However, this is not true. And in fact, oftentimes, in order to think critically about these symptoms and to be able to differentiate fantasy from reality and realize that you are in fact sick, individuals with schizophrenia will need the medications that they take daily to allow them to understand what exactly is going on with their own mind. Now, one of the issues with this is that sometimes, given certain situations, you can court order a person to take meds. Usually given that they have done something that is criminal or even if it's a minimal crime. And so this is one of the issues that can bother people with schizophrenia, because being forced onto a medication regimen can seem traumatic as an experience and hard to process emotionally or logically for someone who has schizophrenia. Individuals with schizophrenia oftentimes go off on tangents and will talk about things unrelated to the subject at hand in a conversation. They might have bizarre or strange behaviors that are not easily ignored or explained away by other things. Individuals with schizophrenia can oftentimes have a flat affect or a lack of mood or emotion expressed on their face. Individuals with schizophrenia can also have positive symptoms, which are things that are added to the personality of the individual in treatment. And this includes things like illusions, hallucinations, and delusions. Delusions are fixed false beliefs, and hallucinations are examples of sensory input that does not come from the objective reality around you, but rather from subjective internal experiences, much like a feedback loop between different regions of the brain. Now, the negative symptoms of schizophrenia are those symptoms that are subtracted from a person's personality, such as anhedonia, the loss of pleasure, apathy, the loss of emotion, poverty of speech, so using a minimal or simplistic vocabulary, given that that individual might use tend to use more complex verbiage. Individuals dealing with schizophrenia will often find that the treatments, the daily medicines that you would take, such as an antipsychotic, that these medicines do not affect the negative symptoms so much as they prevent the positive symptoms. If you're hearing voices, this is not necessarily, or you're having hallucinations, is not necessarily something that is bad or that you can't cope with, but they can be quite negative or abrasive and come in many different forms, such as mumbling or hearing music or dealing with the voices of family members that might plague an individual with schizophrenia. And sometimes they'll assist the person with schizophrenia. They can be a coping mechanism of sorts, and therefore, as a symptom, you can oftentimes rely on them as a crutch, and that's oftentimes something that you don't want to do. You should never reinforce a person's delusions who has schizophrenia, and you should never provoke individuals with schizophrenia. And most individuals with schizophrenia are nonviolent, and they can do bizarre behaviors at different times. One such behavior that's interesting about individuals with schizophrenia is that they might wear a coat in the summertime or shorts in the winter. Now you may be wondering, why is that? And the answer is because when you have schizophrenia, one of the areas of the brain that is affected monitors autonomic functions like heart rate, breathing, and also temperature regulation. So if you have a high temperature or your brain is telling you that, you might go out in snow and feel completely warm. Or go out in the summertime and feel cold. And so these are some of the facts that you deal with when you have schizophrenia. And it can create a rift in your communication with your psychiatrist or your mental health or general practitioner, such that you run into the difficulty of, if you're not aware of your symptoms, you can't think critically about them and you don't think you're sick. It may be hard to communicate these types of things with a doctor. And so that's why it is a good idea to go to a mental health professional such as a psychiatrist who will prescribe medications to you. Psychologists oftentimes work with diagnostic tests such as IQ and other things along that nature. Now, when you have schizophrenia, you can oftentimes have trouble with being able to live a normal everyday life. And so many individuals who have schizophrenia commonly drop out of college, which is something that needs to be solved. And they will do that usually in their sophomore year or freshman year when studying the first 2 years of an associate's to a bachelor's. This can be difficult, and if you have a relative or you are somebody who has schizophrenia, it's oftentimes a good idea to attend a college or university within your area and to use a degree to search for a major that does not cause undue anxiety or difficulty in dealing with your illness. You can, however, use an IEP in higher education, but interestingly enough, when someone is dealing with schizophrenia, one of the most common things among individuals with schizophrenia is homelessness. And a lot of this has to do with the inability to hold a job. And oftentimes we fire people differently based on a mental health problem compared to a physical disability that's visual, or a disability for which it's easier to garner sympathy from your boss or coworkers or the public. However, that's not always the case, but it can be. And schizophrenia is not always visible to the people around you as far as the symptoms that you present. And there can be times where you are not symptomatic, just as much as times when you are severely symptomatic. And episodes of psychosis can occur at different random times in a person's life. However, these tend to center around early 20s as far as onset. Now, when you are treating someone with schizophrenia, they can oftentimes not communicate to their doctors because of that lack of understanding of themselves having symptoms, the inability to address and identify those symptoms, and also the inability to even accept that you need help in the first place.